It's so easy. And then when they don't have it, get vaccinated. We can eliminate it from our lifetime. Out of the 1 out of 10 who have hepatitis B, 1 out of 4 will die of liver cancer. And so if you know an Asian person who died of liver cancer, most likely they had hepatitis B, okay? And there are some communities that are afraid of getting tested. In Fresno, the Hmong community, one of them was tested and was discovered to have tuberculosis. So then they said you have to get treated, and because of their beliefs, they refused treatment. They put him in jail, 6 months. So the word got out that if the government wants to test you for something, don't get tested because they'll put you in jail. And so now, instead of 1 out of 10 Asians in Fresno with hepatitis B in the Hmong community, 7 out of 8 Hmongs in Fresno have hepatitis B. There is a very different approach to knowing the culture and having this sensitivity to language and accessibility of language. That's what I will offer to our community. I shared earlier that in the senior population, which is very reliable voters, in the United States, 80% of seniors are Caucasians. And 18 to 25-year-olds, 54% are Caucasians. So what we know is that when you have a group of people who are very strong at voting and they look at the next generation and they don't look like them, it's hard for them to invest in their future, in better schools for them, in better infrastructure. It's sad, but it's true. So one of the work that I used to do and still continue to do is with a group called Urban Habitat. And we work with the idea of social equity, of looking at how are we developing our housing, our transportation, and making sure that it's accessible to all different people. And that's the statistic they found. That unfortunately, where I used to think if you're a leader, all you have to do is listen well to other people that you're serving and you know what their needs are and you would follow through. But the fact is, if you've not experienced what the people are experiencing or you can't relate with them, they don't look like you, they don't sound like you, it's harder for you to understand their needs. So when I'm at a meeting and I'm the only brown girl there, and then somebody says in that meeting, well, we don't want to put necessarily money into that program because it's for a specific population. And so this happened in a committee that I was serving on for healthcare access and to give grants. And the person says, you know, we gave statistics, 53% of the people in Eden Township, that's Ashland, Cherryland, parts of unincorporated San Leandro and Hayward, said that they speak a language other than English as their first language. Okay? And then we found out that it was, again, very diverse. And so we needed to make sure when we give grants that it goes to existing community activities that already provide language access, that are culturally sensitive, that can speak to their population. So we said, okay, when we look at all of the people that apply for a grant, we're only going to give it to the ones that have language access. Person raises their hand in the committee and says, I don't really agree with that because I really think they should just speak English. And anyways, you know, if you want to battle hypertension, then just put money into hypertension. And my response was, I understand what you mean. I know I wish people would speak English too. I speak 5 languages. And the thing is, though, when you're explaining to someone about their health, you have to explain it in a very specific way. The language of medicine is different, right? You're trying to teach someone about diabetes. You're not going to talk to them like they're a 3rd grader, different from their, a college graduate in Taiwan, right? You don't want to insult them. So the way you speak when you interpret, when you translate, is different in medical language. By the time you learn the language to translate, to interpret, that person's getting sicker. And here you are, you have a community group that already can talk to that community. Give them the money so they can do what they're already good at doing. So this person meant well, but he didn't speak another language. He didn't know that this is, you know, we have a Burmese population in Burma. They speak over 80 languages. Small country. And so it's very hard to make decisions when you can't relate, when you don't have the personal experience to relate to other people. So the person I'm running against is a city council member of Hayward. And we were only 4 percentage points behind in the top 2 for the open primaries. I also was 6 points ahead of the mayor of Union City. And he has given his endorsement enthusiastically, has been campaigning hard to help me get elected. So Mayor Mark Green of Union City has endorsed. He received 42% of the votes in Union City. So this is going to be a big help for us. We have had, even though my opponent is actually a scientist, he's a retired physicist, we still receive the engineers and scientists of California, that organization still endorsed me. And again, it's because of all the work that I've done in the community, and of course all the healthcare communities have stepped up. I did want to share that we had 10,000 California native plants that we delivered in 3 weeks to specific voters, and those were volunteers that helped deliver 10,000 plants. We had 35,000 pot holders with my name in the campaign and a letter accompanied by from my mother. And it said that, you know, please, it ended with, well, actually it started by saying that it always brought smiles to my children's faces when I brought home hot dogs from the Coliseum where I work. But don't worry. We had a balanced diet because my husband worked as a produce guy at Lucky, so he would bring home the vegetables to balance our diet. And then at the end of the letter, he would say, she would say, please vote for my daughter. She won't disappoint you. She didn't disappoint us. So I actually still to this day have people who say, I was just using the pot holder your mother gave me. And I was telling my daughter, my Mrs. Ong made this pot holder for me. And I didn't want to tell her that my mom didn't have time to sew 35,000 pot holders. So we really have been working hard. But don't worry, this is just a warm-up. We'll keep working hard, and then the real hard work will come when we get to Sacramento, and I have the opportunity and the privilege to serve you there. And as I've asked, I think most, if not every one of you, you know, my ask to you is you need to be the voice for me to go up to Sacramento and say, look, I have my own career already. This is a public service. So when you are trying to influence me to make this decision, and my community is saying, that won't work, that's going to hurt us, then I can say that with authority and integrity because you came out and told me with your own voice, okay? So that's my ask for you. You have my contact information. You need to tell me when you hear or learn of a policy that's not working or that could work better or that's going to negatively impact the lives of the people you serve. You need to tell me, and I need to translate that information to them. So I want to thank you again for being here, and I think John had mentioned he'd like to open it up for any questions, and of course I'll be here also, and please, you know, feel always like you can approach me about anything. Thank you, Eric.
Thank you so much for sharing us your experience and how you make a commitment to the community. And I think we're really proud of you. Although you're not really Taiwanese, but we really consider you a part of us. And there's a saying, they say, you always consider your home to the community. So always count on us, okay? We will be the strong basis to support you, and then the Taiwanese community, the reason we pick up the location here because the owner for this building, he actually is a Taiwanese. So you always think, this could be a basis for you. I remember you told me that you go to Sacramento, you had an office in Union City. This is Union City, so good for you. And I think I would like to share something according to the Taiwanese community. Well, we had an election, we always have a slogan. We say, 动算, which means you will be elected. Okay.
Oh, okay.
So before I give you a small, actually, we got a slogan for you. But before we do that, I got a flag for you. That's I think in the future you're going to give the community a lot of proclamation in the future, right?
Okay.
But before you deliver that, we give you one. And this one we put actually, this is very unique. We use your name to make it. Okay. This is your name in Mandarin. That's Jenny, Dr. Jenny. And then the translation is here. You will be overwhelmed and elected. Okay. That's what it is. Yeah. And then we put vertical. They always call this horizontal and vertical.
Okay.
And the vertical is Dr. Ong shares you care the public opinion. That's why you earn so high reputation. That you earn the high praise. Okay. And then this one is that you come to visit the community, and then of course you ask for their support, and also you listen to their voice. And then while you facing the difficulty of the California, especially for the economy and a lot of things, it's a big burden for you. It's a big responsibility for you. And then that's what, once you get to the assembly hall, we wish you make a good decision for the public. And this is the Mandarin portion is the translation. Then let's have a slogan for you. 动算，好不好？动算。Oh, maybe we can get a surprise.
Let me take two actually. I use this one. Okay. Stop here.
Stephanie, you can take a picture for it. So I think Jenny overstayed here.
Yes.
Okay,
yes,
all right.
Absolutely.
So while we enjoy lunch, maybe for a quick one, and then we come back for Q&A. How about that? Okay.
Perfect.
Maybe
Yeah, let's eat.
Let's eat
Yeah.
for 30 minutes. Okay.
Okay. See you.
All right.
See you.
Relax. Okay.
Okay.